Hi, my name is Dr. Valerie Deardorff. I'm an orthopedic surgeon specializing in hand and upper extremity surgery in Overland Park. So if you have a hand injury, oftentimes you'll have pain and swelling, and you might even have trouble moving your hand. Those are reasons that you should seek medical care. It's pretty common that I will see somebody that they notice swelling, they notice some pain, and maybe even a deformity in their finger, but yet they delayed treatment. And then I see them a month to 2 months later, and it's too late. And it's difficult to treat at that point because hand fractures actually can heal pretty quickly. So fractures usually can be treated with a cast, but sometimes we do need surgery. And what I tell my patients is there are typically two criteria that I'm looking for to determine if a patient's fracture can be treated in a cast or with surgery. The first is the overall alignment of the bone. If the bone is reasonably well aligned, your body will knit it together provided that it's immobilized in a cast. The second thing I'm looking for is rotational or angular malalignment. Because if you look at your hand, when you make a fist, all your fingers come down and they don't rotate over each other. So if you have a patient make a fist and their fingers rotating over the other guys, that's typically an indication to do surgery to correct that. And typically I tell patients that fractures take about 6 weeks to heal and another month or so to get strong enough to withstand a heavy force. So if somebody's wanting to get back to their prior activities, such as rock climbing or exercising or even just cooking and lifting heavy pots, that's about 10 weeks after the injury. The other thing is that sometimes if you have a small little fracture of the finger, we don't cast those or splint those. And sometimes we'll just buddy tape those and get patients moving really quickly. And so that's why it's important for patients to seek treatment if they think they have a hand fracture, because sometimes you don't need to treat it in a splint. And sometimes it really does need motion, but only a hand surgeon or an expert in treating hand fractures can determine that. So if you think you have a hand fracture or a hand injury that needs to be evaluated, please don't hesitate to contact me. I'd be happy to see you.